Oh,
Hi, Robert. I'm Julia. I'm going to be the one doing your physical exam today. Nice to meet you.
yep.
So tell me, what brings you in? I know that you're here to establish new care, but are you having any other concerns at this time?
Yeah, I'm having headaches.
Okay. All right. How long have those been going on?
Over the last couple of years.
The last couple of years. And how often are you getting those headaches?
Mm, 2 or 3 times a month.
Okay. Okay. And then how long do they last when they
All day.
all day? And for how many days? How many hours?
Yeah, it's usually like one day.
Okay.
If I catch it, I usually take Imatrix.
Oh, okay. Imitrex. Okay.
Yep.
And that seems to help.
Yes.
Okay. And then the severity, does it interfere with any of your daily life or anything like
Just
that?
on the day that I get it.
Okay. Are you missing work?
No, I try not to, but
Okay.
I can if it's on a work day.
Okay. Like in the past year, how many days of work have you missed because of
I
that?
haven't missed any.
Okay. Okay. And like when you get the headaches, where are they kind of located on your
I
head?
get it right here.
Right in the forehead there.
Yep.
Okay. All right. Is there? I know you said that the Imitrex works. Is there anything else that you take that seems to help with that?
Ibuprofen can help.
Okay. All right. And then, do they seem to be getting better, or they're less?
Yeah, less frequent.
Less frequently.
Yep.
Okay. All right. And any other symptoms?
No.
Okay. All right. Gotcha. We're going to talk a little bit about your past medical history. How do you think your overall general health is right now?
That's good.
Okay. Do you have any allergies or anything?
Just to steroids.
Oh, to steroids. Prednisone?
Prednisone, yeah.
Okay. Okay. Any food allergies or
Not that I'm aware of.
environmental allergies, hay fever?
Hay fever, yeah.
Okay.
Cut grass.
Okay, gotcha. What about your surgical history? Have you ever had surgery?
Yes, I had a head injury and
Okay.
a hernia.
Oh, head injury and a hernia. How old were you when you had head injury?
Young, like one.
Okay. What happened?
Fell 2 stories.
Oh, wow. Was that pretty big recovery then?
Yeah.
In the hospital for...
Yeah, I wouldn't know. I was young.
Okay, gotcha. Any other serious injuries?
No.
Okay. And you had said the hernia too. What
Yep.
year? How old were you when you?
That was 2000. Yeah, 2002.
Okay. All right. Did you have that when you were working?
Yes.
Or okay.
Yeah, it was
Did you
work-related injury.
lift something and
Yeah,
okay.
lifted something. Yeah.
Gotcha. And any problems with that since or?
No.
Okay, gotcha. What about medications? Do you take any regular medications?
No.
Okay, gotcha. All right. Any cardiac history? Do you have any hypertension or
No.
no history of heart attack or
No.
anything like that? Okay. Um, what about with your lungs? Any problems with asthma?
No.
Or any other respiratory diseases?
No.
Okay. Sinuses? Do you get a lot of sinus infections throughout the year or anything? Okay. What about digestive? Any problems with your stomach or
Yes,
intestines?
I've been diagnosed with Barrett's esophagus.
Oh, okay. And have you been scoped with that?
Yes.
EGD?
Yes.
Okay, when was the last time that you had that done?
2008.
Okay, 2008. Okay, gotcha. And then, what about urinary? Any problems with going to the bathroom or anything like that? Any problems with your prostate?
No.
Okay. What about history of diabetes? Any
No.
thyroid disease?
No.
No problems with excessive thirst or
No.
like a lot of fatigue or anything like that?
No.
Okay. Any history of anemia?
No.
Okay. What about with your skin? Any problems with any
Yeah,
rashes?
I get a little flaky in my face.
Some dry skin?
Dry skin, yeah.
Okay. Is that seasonal or is that like all the time?
No. Only when I shave it'll flake off.
Oh, okay. And have you had a treatment for that before?
Yeah, they gave me like a lotion.
Okay.
And a steroid. I don't use the steroid though.
Oh, okay. All right. And that lotion seems to work for
yeah.
you? Gotcha. Okay. What about any problems? Have you ever had a history of seizures or anything like that? I know
No.
you've had the head injury, so.
No.
And have you been evaluated since by a neurologist?
Yes.
Okay, and everything looks good and
Yep.
stuff? Okay. Any follow-up that he recommended or anything?
No.
All right. What about your vision? Any problems with your vision?
No.
No history of glaucoma or macular degeneration?
No.
And then, what about with your muscles and everything? Any problems with coordination or balance or anything?
No.
Any problems with your back or?
I have a bulged disc in C6 and C7.
Okay. And when were you diagnosed with that?
2 years ago.
Okay. And what are you doing for that? What do they have you do?
Nothing.
Okay. And are you taking anything for that? Any?
Ibuprofen if it bothers me
Does
enough.
it seem to help?
Yeah.
Okay. Gotcha. All right. Any problems with depression or anxiety?
No.
Okay. A little bit about preventative. Have you had your tetanus shot?
Yeah.
Do you remember when your last tetanus shot
It was in 2008.
Okay. All right. What about flu shots? Do you get flu shots?
No.
And then what about pneumovax? It's like they call it the pneumonia shot. A lot of people.
No.
All right. And then like some of the screenings too that are out there. Have you ever had a colonoscopy?
No.
What about a bone density test?
No.
There's a test called a PPD. It's for tuberculosis. Have you ever had that?
Yes.
All right.
Had a false positive.
Okay. And so what did they do? Did they do a chest X-ray?
Quantum Faringold.
Oh, quantum Faringold, and that was
negative.
Okay. And then what about cholesterol? Have you had a recent cholesterol?
Yes, and it was high.
It was high. And did you go on medication for that?
No.
What are you doing for that right now?
Changing my diet and a little exercise.
Okay. So when did you have that done? Because we're going to be getting the records over, but we haven't gotten them yet. So.
Last year.
Okay, so it's been a little while, so we should probably get another.
Mm-hmm.
What about your glucose, your blood sugars?
That was good.
That was good. Okay.
Mm-hmm.
All right. A little bit about your family. What about your mother? Is your mother still alive?
Yes.
And how old is she?
56.
Any significant history? Any cancer, heart disease, or anything like that?
Mm-mm.
All right. What about your father?
Yes, he's still alive.
Okay. And what about his health history?
He's not around. He's.
Okay. Tell me about
I have a stepdad.
Oh, okay. All right. So have you met your?
No.
Okay, so you don't know his history.
I don't know his history.
Okay, gotcha. All right. Do you have any other relatives with any cancer or?
My grandmother died from it.
What type of cancer was that?
Throat and lung.
Was she a smoker?
Yes.
Okay. Any other colon, breast, or prostate cancer in the
Not that
family?
I'm aware
of. What about heart disease?
Not that I'm aware of.
Any diabetes in the family?
Not that I'm aware of.
And thyroid? No thyroid disease either?
No.
Okay. And then, no, what about asthma? Any asthma in the family?
Some aunts have it, yes.
Some of your aunts do. Any other significant medical history in the family?
Not that I'm aware of.
Okay. So, a little bit about you with your social history. Where do you live?
Stanley.
Oh, in Stanley? Okay. Gotcha. Did you grow up in Stanley then, too?
No.
Where did you grow up?
In Milwaukee area.
Oh, okay. All right. And then you moved up to Stanley. What year was that?
2004.
Oh, okay. Are you married? Do you have children?
Yes.
Okay. How many children do you have? Or?
3 stepchildren, 3 stepdaughters, a daughter of my own, and a son.
Okay. And then, are they in the house yet, or are they?
Our son is.
Okay. All right. And how old is he? He's
12. 9.
All right. And how's he doing? Is everything good with him? Okay, gotcha. What about your nutrition? You said you have the high cholesterol. What are you doing about like with your meals and stuff like that? Are you doing anything?
Yeah, trying to cut out fast food and
Okay,
more fruit.
gotcha. Vegetables too, or?
Yeah, some.
Okay. And fat too.
Yeah.
Lower the fat.
Mm-hmm.
On an average night, do you get enough sleep, or how many hours?
I'm not sure.
Okay, so.
It's probably 6 to 8.
6 to 8 hours.
Yeah.
Okay. Do you smoke?
No.
Do you chew tobacco?
No.
What about alcohol? Do you drink any alcohol?
On occasion.
Okay. Well, how many drinks in a week do you?
About 3.
All right. What about your job? What do you do for a job?
I'm in corrections.
Oh, okay. And is there any hazards with that? I assume there is because you're working with inmates.
Yes.
There's like your hazards with infectious disease and things
Yes.
like that.
Mm-hmm.
So it's good that you're getting your tuberculosis screenings
Right. Mm-hmm.
Provided through your work.
Right.
Okay. Any problems with your sexual health at all?
No.
Any concerns?
No.
And then number of partners?
1.
Okay. Any concerns with any sexually transmitted diseases or anything? I know those questions are awkward, but.
Yep.
And then last couple of questions. Do you do testicular exams?
Yes.
Okay. And how often do you do those?
Once a month.
Okay. And then have you done any traveling?
No.
Okay, so no traveling.
Mm-hmm.
And I know the big question right now is if you've traveled to any of the Western African countries.
Nope.
Okay, sounds good. So I'm done with my questions here, so I'll have you get in your gown and then we'll do your physical exam, okay?
Okay.
All right, thanks. I'll see you in a few minutes.
Yep.